There are warnings that Australian workplaces are ill-equipped to deal with a coming tsunami of dementia cases. Experts say businesses could find themselves being sued for the actions of workers affected by dementia. The looming crisis will be caused, they say, by the combination of an ageing population and delayed retirement. But there are no clear plans in place to deal with it. Karen Tan has this exclusive report.
In Still Alice, actress Julianne Moore plays a linguistics professor who develops early-onset Alzheimer's disease at 50 and portrays how dementia can affect anyone.
So I've seen a veterinary surgeon, for example, who obviously couldn't perform vet surgery. I've seen a barrister who was no longer able to give legal advice.
Keith Glantz held down a supervisory role in telecommunications for more than 20 years, but had to retire when he was diagnosed with dementia, aged 53.
I'd lost my way, where 2 hours ago I was full of gusto and thought I had a pretty good day, but all of a sudden I couldn't find my car.
He started to forget, where he had to be at what time. He couldn't actually manage any of that.
We are certainly aware of the increasing incidence, and in the same way that we've tackled mental health in the workplace, I believe we will similarly tackle dementia in the workplace.
Dementia at work is becoming a growing concern, yet little research has been done about how best to deal with it.
If we ignore this issue, it's at our peril. We're going to see an increasing prevalence of this condition, and we can't afford to ignore it.
Gordon James was a trained broker from Lloyd's of London. He and his wife later worked together in a home business. He now has end-stage frontotemporal dementia.
There are certain obligations that are required by law, and we may have been letting some clients down, and some mistakes could have been made. Fortunately, they weren't made, but they could easily have been made.
And that's a worry for employers dealing with dementia in the workplace.
I think the potential for litigation is very real. If their careers have been impacted upon by bad decisions, bad thinking, they may be sued as an organisation because of bad decisions.
Yes, employers are at risk and they worry about those sorts of things. Should they change the job, modify it, simplify it, etc.? In some cases that'll be possible. Should it be an obligation, a legal responsibility? It should not.
340,000 Australians currently have dementia. 25,000 of them are under the age of 65. Those numbers will increase by a third in less than 10 years. Yet there's still no cohesive national framework in place to manage the growing condition in the workplace. While countries like the UK and Canada have already done much to prepare for the impact of employees with dementia, there are concerns Australia is being left behind.
I don't think the Australian workplace is currently set. They haven't established policies and procedures. HR departments don't know what to do yet.
The federal government hasn't ruled out including dementia into the National Disability Insurance Scheme to address the growing problem in the workplace. Karen Tan, ABC News.